Hey guys, John Adamson, the Rehab and Documentation Guru today. Enjoying a Wawa iced coffee. 'Tis the season of pumpkin spice, which is just wonderful. I just love the fall flavors and, of course, going into Christmas. Anyway, you're not watching me to talk about coffee. Maybe you are, I don't know. But I want to talk a little bit about the craziness of the opioid crackdown. And it is craziness in a way, because on the one hand, yes, if we can get people off opioids, and we have a so-called opioid epidemic, and rightly so. I mean, there are people that have abused them, but I'm sure all of you can think of patients that you have seen at some point who truly need opioids. And case in point, I saw one today. I have a guy who's under the age of 40 who has a muscular dystrophy. So he's progressively losing muscle function. On top of that, he's got osteoporosis. And from the sounds of it, although I need to confirm this diagnosis, he's had some compression fractures of his lumbar spine. And so muscle imbalance, compression fractures, limited mobility, he's in a lot of pain. And yet, he's on virtually nothing. The doctor gave him Neurontin. Now, I'm not the strongest in pharmacology, but I know Neurontin is often used with patients for peripheral neuropathy. In fact, some orthopedists in my area are now using Neurontin post-hip and post-knee replacement surgery with, I guess, some positive benefits. It's actually been helpful. But, there's only certain medicines are designed for certain things, and as the name implies, Neurontin, it is related to nerve pain. I don't know much more than that. Maybe some of you who are stronger in pharmacology can make some points. And yet this guy has collapsed bones. He has bone issues, bone pain, and the Neurontin's not touching him. And he's living with, he describes 8 out of 10 plus pain. And I believe him. I look at him, he's depressed, obviously, he's losing his function. And so I sent a note to the doctor. One thing we're going to try with him, and he's never tried, is TENS. And hopefully that'll give him some relief. 2, he's trying to transfer with a mother who's elderly, who's like basically bodily lifting him, and he's a big dude. And he's got a poorly fit Hoyer lift. The guy's 6'4". He was given a Hoyer lift with the smallest possible pad. I don't know who was thinking on that. Probably not thinking. Anyway, we're going to try to help with those 2 areas, get a more appropriate pad and also the pain management issue. But I'm letting the doctor know, because he used to be on oxycodone. I said, patient reports. He had previous excellent results from quality of life standpoint and capability of participating in ADLs when he was on oxycodone. I'm just going to leave it like that. So I think, we have to be advocating for our patients with chronic pain issues who used to get really good relief from narcotics, opioids. Some patients need it. That's why it was developed. And so we need to be advocates for them, because it's ridiculous that you should penalize the group of people that truly need this stuff just because there are some bad apples out there. That's just ridiculous. Anyway, just ranting and raving a little bit, and hope you're having a great day. Please leave comments. If you get some ideas of what you've seen to be helpful, if you're stronger than me in pharmacology, please leave some points. And anyway, take care. God bless. And remember, pumpkin spiced iced coffee. Outstanding. Bye-bye.